Nettie raised 6 children and buried none of them before they were grown, in a holler where the nearest doctor was half a day's ride on a good road, which this wasn't. Everything she knew about doctoring came out of her mother, and her mother's mother, and it was the only medicine most families up here ever saw. A granny woman like her was the whole hospital for a stretch of mountain that might not have another one for 20 miles. Now, before I go one word further, I want to say something plain, because this is a different kind of video than the ones I usually make. I am not a doctor. I never claimed to be one. I spent 31 years in a coal mine, not a hospital. Everything you're about to hear is what Nettie did, or what the old-timers around here did, back when making do with what grew in the yard was the only medicine there was. Some of it turned out to actually work, and I'll tell you where the science backs it up. And some of it could genuinely hurt you or somebody you love, and I am going to tell you that just as plainly as I tell you the rest. This is history. It is not medical advice. If you or your baby are sick, call a doctor, not a video, mine included. Here's the twist. Number 4 is one I'm going to tell you flat out, right now, not to ever do, and it's killed grown women who thought they knew better. Number 2 is sitting in hospital burn units today, doing exactly the job Nettie used it for. And number 1, I'd bet near every one of you had done to you as a baby, and it could have hurt you worse than you know. 25 lost mountain home remedies. Let's count them down. Number 25, the asafoetida bag. Every winter Nettie sewed a lump of asafoetida resin into a little cloth bag and hung it round our necks, and she swore up and down it kept the flu off. It smells like sulfur and rotten eggs, and I mean that literally, and half the point of wearing one might just have been that nobody sick wanted to stand close enough to give you anything. There's no dose of anything coming off a bag on a string that could touch a virus, and I have to tell you plain there's no mechanism for it at all. But here's the part that's true and worth knowing. The United States Pharmacopoeia actually listed asafoetida in 1918 as a remedy people reached for against the Spanish flu, and children all through these mountains and out in the Ozarks wore what they called an aspidity bag clean through flu season, measles, and later polio. It didn't work. Nobody knew that yet, and there was precious little else to try. It's a real piece of history, and a harmless one, and every family up here over 60 years old has a story about that smell. Number 24, cobwebs on a cut. Old-timers packed a fresh cut with cobwebs straight off the barn rafters, and I want to stop you before you try it. Nobody has ever run a study on cobwebs as medicine, because there's nothing there to study, and near as I can find, not one scientist has ever bothered to look for what everybody assumed was there. What is there for certain is dirt, dead insect parts, mold spores, and whatever bacteria was living on that unwashed rafter for however many years, and packing that straight into an open wound is a fine way to get an infection, not stop one. Grandma's generation didn't have a tube of antibiotic ointment sitting under the sink, and they made do with what was overhead. We do have that tube now. Wash the cut, cover it clean, and if it's deep or dirty, get a tetanus check. That one's history, and it should stay there. Number 23, sulfur and molasses every spring. Come the first warm days, the whole family lined up for a spoonful of sulfur mixed into molasses to thin the blood after a long winter shut up indoors. That was the whole theory of it, that your blood ran thick and sluggish in the cold months and needed cutting loose come spring, the same way you'd thin paint. There's no such thing as blood running thick by the season, and there was no germ theory yet, no notion of vitamins, to tell anybody otherwise. It's not dangerous in the amount a spoon holds. It's just wrong. And it's wrong in about the sweetest possible way, because for a poor family in March, that spoonful of molasses was as close to a treat as the pantry offered. Number 22. Chewed plantain on a sting. You know the weed. Broad-ribbed leaves, grows in every yard and every ditch in this country whether you plant it or not. Nettie'd pick one, chew it right there in the field to get it wet and broken down, and press it on a bee sting or a nettle burn. Now here's an honest one for you, and I looked hard for an answer. I went hunting for a study on plantain and stings, and there isn't one. Not one that says it works, not one that says it doesn't. That's a genuine gap in the research, not a debunking. And those are two different things I want you to be able to tell apart by the end of this video. I can't tell you the chewed leaf does anything beyond a cool, wet, faintly bitter poultice feeling good on hot, angry skin, and I can't tell you it doesn't do more than that either. Nobody's ever checked, in either direction. Number 21. Blackberry root tea for the trots. Both the Cherokee who were on this land before us and the Scots-Irish who came in after boiled blackberry root down for dysentery, and there's real chemistry sitting under that agreement between two different peoples who never compared notes. Blackberry root is loaded with tannins, and tannins are honest-to-goodness astringent compounds, the same family that makes a green persimmon pucker your mouth. And in animal studies, they measurably slow the loss of fluid through the gut. What's missing, and I looked, is the human trial. Nobody has ever run one on a person with dysentery drinking this tea. So the chemistry is real, and it is not folklore, and the leap from a lab animal to your kitchen table has never once been tested on a living person. And I'd rather tell you that plainly than let you think it's proven when it's only promising. Number 20. Catnip tea for a colicky baby. Some of the older women gave a weak catnip tea to a fussy, colicky infant, and I want to spend more time on this one than its place on the list would suggest, because it's about a baby, and babies don't get a vote in what goes in their own mouth. Catnip has never once been put through a real safety trial in an infant. Not one anywhere. On its own, it can cause vomiting, and a baby's body doesn't clear anything from its system the way yours or mine does. So what's a mild, pleasant sedative in a grown woman's cup of tea is an unknown quantity entirely in a 6-month-old. Nobody knowing whether a thing is safe is not the same as it being safe. And that difference matters most exactly where the stakes are highest. If your baby's colicky and won't settle, that's a call to a pediatrician, not a pot of tea on the stove. And I mean that every bit as much as I'll mean it again before we're through here tonight. Number 19. Mullein tea, the flannel leaf. Old folks called mullein flannel leaf, on account of how soft and fuzzy the leaf feels in your hand, near like a scrap cut off a work shirt, and they steeped it for a bad cough that wouldn't loosen up. There's a real mechanism worth taking seriously here. The leaf carries mucilage in it, a gel-like substance that coats and soothes irritated tissue on contact, and it's got saponins besides, compounds that help loosen up thick mucus, so a cough can actually clear something instead of just rattling. The mechanism is plausible, genuinely so, and the human clinical trials behind it are still thin on the ground, with the researchers who've reviewed the literature saying plainly that the evidence is still developing. It's one of the more reasonable bets on this whole list, and I still can't stand here and call it proven. Number 18. A mustard plaster or an onion in a sock on the chest. For a bad chest cold that wouldn't break, A mustard plaster or a sliced onion tucked warm into a sock went right on the chest overnight, on the old idea that the heat and the burn of it drew the congestion up and out through the skin. There's no modern evidence it does a single thing for a cold, a chest infection, or bronchitis, and the burning part of that sentence isn't just a figure of speech describing the sensation. Mustard plasters left on too long have caused genuine skin irritation and real chemical burns, documented in the medical literature, not just old wives' warnings. If you want to try one for the nostalgia of the smell and the heat, keep it off bare skin more than a few minutes at a time, because it will burn you same as a hot stove lid would, given enough time against your skin. Number 17. A morning tonic of apple cider vinegar. A tablespoon stirred into a glass of water first thing in the morning, and I'll split this one straight down the middle, because both halves of it are true at once. Taken diluted, now and then, there's some thin, preliminary evidence it does a little something modest for blood sugar, though nothing settled enough for a doctor to prescribe it. Taken any other way is where the real trouble starts. There's a documented history in the medical literature of people burning their throat and their esophagus on straight, undiluted vinegar and on the vinegar tablets that can lodge partway down going down dry. Never drink it straight and never swallow a tablet without a full glass of water behind it. It's an acid. That's not a figure of speech either, no more than the mustard burn was. Number 16. Steam under a towel for a cold. Lean over a pot of hot water, throw a towel over your head to trap the steam, and breathe it in deep until your eyes water. The actual research on this, a real review pulling together the studies that exist, found no consistent benefit for cold symptoms at all, heated or humidified air or otherwise, and every single year burn units on both sides of the ocean see people, mostly children, scalded bad from that exact pot tipping over into a lap, a face, or worse. It isn't a rare fluke, it's a recurring enough injury that hospitals track it. If you want moist air down in your lungs, run a hot shower with the bathroom door shut and sit in there a while. Leave the pot where it belongs, which is on the stove and nowhere near your face or a child's. Number 15. Boneset tea for the fever. Boneset is an old remedy, old enough that it was carried in the actual United States Pharmacopoeia, the official list of recognized medicines, from 1820 clear through to 1916, which tells you plainly how seriously it was once taken by trained doctors, not just grannies. It got its common name from breakbone fever, the old-fashioned word for the deep aching that came with certain fevers, because boneset was the thing reached for against exactly that ache. Here's what wasn't known back then, and couldn't have been. Boneset carries the same class of liver-damaging compound found in comfrey, called pyrrolizidine alkaloids, and the amount of it changes from plant to plant, season to season, with no way on earth to tell a safe cup from a dangerous one just by looking at the leaf or tasting the tea. I wouldn't drink something I couldn't test, and neither should you. Number 14. Yellow root for an infection. Chewed raw right off the root, or steeped into a strong tea. Yellow root, what the herb catalogs and the health food stores now call golden seal, was reached for a sore throat or most any infection going around. There's a compound in it called berberine that genuinely measurably kills germs, bacteria, and fungus both, and I mean that's held up clean in a laboratory dish, tested and repeated. Here's the catch, nobody selling it in a capsule will tell you plainly. When a person actually drinks it, the body absorbs almost none of that berberine into the bloodstream. So what reliably kills bacteria sitting on a glass slide doesn't reliably do the same thing once it's past your stomach and into you. The federal health researchers who've reviewed it say there isn't good evidence it treats a cold, a sinus infection, or a urinary infection in an actual person, and it shouldn't go anywhere near a pregnant woman, a nursing mother, or a baby, and it can throw off the dosing of at least one common diabetes medication besides. Number 13. A wet tobacco leaf on a sting or a swelling. This one I want to be direct about because it sounds like the mildest thing on this whole list, and it might genuinely be the most dangerous one hiding in plain sight. A wet tobacco leaf pressed against skin isn't really a poultice at all. It's a delivery system. Nicotine passes straight through skin into the bloodstream with almost nothing standing in its way, and tobacco field workers today get genuinely whole body sick with a name and a file number in the medical literature, just from wet leaves brushing against bare arms during a normal day's harvest. That's not a folk remedy gone slightly wrong. That's a documented occupational poisoning with the mechanism fully worked out. Don't do this one, not on yourself and not on anybody you're trying to help. It is not a topical remedy. It's a way to poison yourself through the very skin you were trying to heal. Number 12. A crushed garlic clove on an infection. Nettie swore by a crushed clove pressed right on a cut or a boil overnight, wrapped down tight with a rag. And here's a case, rare on this list, where the old folklore and the modern lab agree more than you'd expect going in. Crushed garlic releases a compound called allicin the moment it's cut or mashed, and that allicin has shown real, documented, broad-spectrum antibacterial and antifungal action in study after study, including against some germs that shrug off modern antibiotics. But that same allicin is genuinely hard on human skin. A review pulling together published medical case reports found raw garlic left in contact with skin, causing real second-degree chemical burns, and dead, blackened tissue in the worst of them, including one documented case of a 3-month-old infant burned by garlic taped over his chest for an ordinary cough. The germ-killing power is real chemistry, not folklore. Eat it in your food all you like. Don't tape it to a baby or to yourself and leave it there. Number 11. Warm salt water, gargled. Here's one that just plain works, near as anybody can tell from the actual data. A real trial of somewhere around 400 volunteers found that people who gargled regularly cut their upper respiratory infections by close to 40% compared to those who didn't, and separate symptom studies show it genuinely eases the pain and swelling of an ordinary sore throat while you're sick, not just after. It won't touch strep, and it's no cure for anything serious sitting deeper in your chest. But for the plain, scratchy misery of a cold coming on, warm salt water is about as honest and as cheap a remedy as this entire list has to offer, and it costs you a glass of water and a pinch of salt. Number 10. Slippery elm bark. Slippery elm carries a genuine coating property, a mucilage, the same word as with mullein, that soothes a raw throat right on contact the moment it goes down, no different in principle from what's sitting inside a store-bought lozenge you'd buy at any drugstore. This is one of the very few herbs the Federal Health Agency has formally recognized as a safe treatment specifically for throat irritation, which is about as solid a stamp of approval as anything out of the old herb cabinet ever earned from the modern world. It isn't a cure for whatever's making your throat sore in the first place. It's a coat laid down over a raw place. And that turns out to be a genuinely real and useful thing for a sore throat to be. No exaggeration needed. Number 9. Jewelweed on poison ivy. This is the best one on the whole list, because the actual science genuinely disagrees with itself, and I want you to see both sides laid out plain rather than pick one for you. Jewelweed grows wild right alongside poison ivy half the time, close enough you could pull both in the same handful. And every mountain family up here has a story about rubbing the crushed stem straight on a poison ivy rash. One real double-blind trial, the kind where neither the patient nor the researcher knows which is which until after, found no significant difference at all between jewelweed juice and plain salt water. None. A different later study, built differently, found that fresh jewelweed crushed into a mash used quick, close to the time of exposure, did measurably cut the rash down, while the jewelweed soaps you can buy off a shelf today did no better at all than soap with none of it in there. So it might genuinely help if you catch it fast and crush the plant yourself right there in the woods, and the bottled version sitting in a store probably isn't doing anything more than the soap alone would. Grandma believed it with her whole heart. The lab is still arguing about it, honestly, right now. Number 8. Ginger for a sour stomach. Ginger is the one home remedy modern medicine came around on hardest, and the clinical trials back it up about as well as anything sitting in a pharmacy today. One study of surgery patients found only 21% had nausea afterward on ginger, against 41% on nothing at all, roughly cutting the misery in half. A separate trial found it worked about as well as vitamin B6, a standard remedy for the nausea that comes with early pregnancy. It's shown real benefit against the nausea that comes with chemotherapy. And in one trial with sick children, it cut vomiting from a stomach bug down from 87% of kids to 67% against a placebo. This is about as close to a settled, proven case as old-fashioned folk medicine ever gets, and Nettie would have told you the same thing without needing a single one of those numbers. Number 7. Peppermint for the gut. Peppermint genuinely relaxes the smooth muscle running the length of your gut, working on the same calcium channels a doctor might target with medication, and a real review pulling together 10 separate studies and over 1,000 people found peppermint oil beat a placebo for the kind of chronic stomach trouble doctors call irritable bowel syndrome, cutting both the general symptoms and the abdominal pain specifically. That evidence is strong enough now that the gut specialist's own professional medical guidelines recommend it outright for exactly that use. The one catch worth knowing is that nearly all of that proof is for the enteric-coated capsule form specifically, the kind that survives the stomach and releases lower down, not a cup of peppermint tea steeped on the stove. So don't go in expecting the tea to match the capsule's results. Number 6. A drop of clove oil on a bad tooth. For a toothache before you could get anywhere near a dentist, which up here could mean days, a single drop of clove oil pressed straight onto the aching tooth was the standard remedy passed down mother to daughter. There's real numbing chemistry behind it, a compound called eugenol that blocks the nerve signal in roughly the same general way a dentist numbing shot does, just gentler and far shorter lived. A real clinical trial of 73 adults found clove oil worked just as well as a standard drugstore numbing gel at easing the pain, and separate trials on wisdom tooth patients and root canal patients found the same pattern holding up. It's a bridge to get you to the dentist chair, not a fix for what's actually wrong with the tooth, and using it too heavy or too often will irritate the very gum tissue it's meant to help. Number 5. A spoonful of turpentine or a swallow of kerosene for worms or a cold. Old-timers really did this, and I need you to hear plainly just how dangerous it actually was, because I don't think most people alive today understand it. Turpentine can shut a person's kidneys down entirely, take their eyesight, cause real bleeding in the gut, and there is no antidote for it at all. None. And as little as a spoonful and a half has been enough to kill a small child outright. Kerosene is dangerous in its own particular way, because even a small swallowed amount gets breathed into the lungs by accident on the way down, and burns the lung tissue from the inside out, which is still to this day the most common kind of accidental poisoning in children living in homes where a can of it is kept for a lamp or a heater. If you take exactly one thing away from this entire video, take this single sentence: turpentine and kerosene are not medicine. Full stop. No exceptions. No matter what anybody's grandfather swore by. If anybody has swallowed either one, call Poison Control right now, this minute, at 1-800-222-1222. Number 4. Pennyroyal Tea. I want to be dead plain about this one, because it's the whole reason I sat down and put this particular video together the way I did. Pennyroyal tea was brewed up to bring on a late cycle, or sometimes for nothing worse than an ordinary cold, and it has killed teenage girls who thought they knew what they were doing. The oil in that plant turns inside your own liver into a compound that strips your liver of the very thing it needs to defend itself from damage. Less than a teaspoon of the oil has caused real, documented harm. A little more than a tablespoon has been fatal outright. There is case after case in the medical literature of liver failure, kidney failure, seizures, and death from this plant, and there is no antidote for any part of it once it's underway. Do not drink pennyroyal tea. Not for a late cycle, not for a cold, not for anything. This is history in this video, and only history. It is not a remedy, and by rights it never should have been treated as one. Number 3. Comfrey, what Nettie called knitbone. Here's a case where two entirely different remedies are wearing the exact same name, and you need to be able to tell which is which before you go anywhere near this plant. A comfrey poultice, laid on unbroken skin, for a bruise or a sprain, is genuinely one of the safer old remedies on this whole list, and there's decent modern evidence standing behind that specific use. Comfrey taken as a tea, swallowed down into your stomach, is an entirely different animal wearing the same leaf. It carries the same liver-destroying compounds found in boneset, strong enough that it can shut a human liver down for good, and it's now restricted or outright banned in most countries for that exact reason. The poultice, on skin that isn't broken, fine. The tea in your mouth, never, not once. And never lay it over an open wound either, because it can heal the surface shut over an infection that's still working away underneath, unseen, which is its own kind of trouble. Number 2. Honey on a cut or a burn. Nettie reached for the honey jar before she ever reached for a bandage from a store, and this is the one on the whole list that turned out to be ahead of its time by about 100 years. A real systematic review of the clinical evidence found honey worked measurably better than ordinary dressings for burns, and for wounds that had gotten infected after surgery, healing them faster by a real margin, not just a feeling. Hospital burn units use medical-grade honey dressings today, for the exact same underlying reasons Nettie's plain kitchen honey worked on us as children: the natural acidity and the hydrogen peroxide the honey itself makes on contact with a wound. One caution here that has nothing whatsoever to do with cuts or burns. Never give honey by mouth to a baby under 1 year old, not even a trace of it on a pacifier, because of the real risk of infant botulism. On a wound, on grown or older skin, honey is one of the only things on this entire list a modern hospital would stand shoulder to shoulder with Nettie and agree on. Number 1. Whiskey rubbed on a baby's gums. And here's the one I'd bet near every single one of you watching had done to you, or did to your own child for teething. A little whiskey on a fingertip, rubbed straight onto the sore gums to quiet a fussy baby down. I already know what's coming in the comments, so let me say it before you do. My grandma did this to me and I turned out just fine. I believe you, honestly I do. I'm also telling you plainly, right here, don't do it to yours. There is no safe amount of alcohol for an infant. Full stop, no threshold, because a baby's liver simply cannot process it the way an adult's can. Not even close. And here's the part that might genuinely surprise you. It likely never numbed a single thing to begin with. What actually calmed that baby down was being mildly sedated toward sleep, not the pain going away underneath the numbing. It worked, when it worked at all, by accident, on the one part of a baby you least want to be experimenting on without knowing why. So there's your 25. Some of what Nettie did, science eventually caught up to and confirmed outright. Ginger, honey, salt water, slippery elm, peppermint, clove oil, all of it holds up under a real trial. And some of what she did she only ever got away with because nothing went wrong that particular time, in that particular house. And I'd be lying straight to your face if I called that the same thing as safe. Here's my challenge, and I'm going to be careful how I word it this time, given everything you just heard. Go make yourself a cup of ginger tea next time your stomach's off, or gargle warm salt water for that scratchy throat coming on, and see for yourself which of Nettie's old tricks actually earned their place in that kitchen, and which ones just got lucky for a few generations running. Then tell me in the comments, and I want the honest version, not the polished one. What did your family actually do, good or bad, that you'd never in 100 years do to your own kids now that you know better? What was it? Whose kitchen did it come out of? And what county was it in? I'm not looking to shame anybody's grandmother. I'm looking to get the whole truth of it written down before it's gone for good. The parts that worked right alongside the parts that scared us. They never wrote it down. I just did.